There will be a conference gathering in London today with campaigners, health professionals and patients from right across the country, campaigning with an organisation called Keep NHS Public. And they're calling for action to protect primary care services within the NHS. I'm joined by Dr. Tony O'Sullivan, who is the co-chair of Keep Our NHS Public and a retired consultant paediatrician. Dr. O'Sullivan, thank you for joining us. What are the main concerns about primary care services and why are they a concern now?
Well, GP, access to a family doctor, is actually the cornerstone of the NHS, where anybody and everybody can get professional advice and either be reassured about their health or be treated by their GP or indeed referred on to the correct specialty. And it's close to their home. And ideally, you're seeing a doctor or a team of doctors that you know and that they know you, and they can give you continuity of care, which actually, research-wise, is absolutely safer and gives better outcomes. But over the last 20 years, the percentage of the NHS budget that's given to primary care, to GP services, the GPs and their team, has fallen from about 11% of the NHS budget to 8%. And more and more doctors in general practice are feeling under absolutely intense pressure. The average number of patients that a qualified full-time GP is responsible for is 2,200 patients per doctor, and that's gone up by 16% in the last 10 years. And that compares with France, which is less than half of the number of patients per doctor. And of course, they have over 30% more doctors in France and 50% more in Germany. So the doctors are increasingly under intense pressure. Patients believe in the NHS and they actually trust their doctors, but it's increasingly hard for patients to get to see their doctors because there simply aren't enough of them.
If this is mostly down to funding, why do you think that the proportion of money being given to GPs has reduced like that? I mean, we know there's an awful lot of pressure on all levels of the NHS, particularly with pressures on waiting lists and things like that. Why do you feel that GPs seem to be at the back of the queue?
Well, I think historically, over the last 20 or 30 years, GPs were not given the primacy of respect and position in the NHS that they deserve. They're called the gatekeepers of the NHS, but they're actually the first port of call for the general population. And literally from the cradle to the grave, families rely on access to a GP. But it hasn't been given the same sort of status as, cardiology or neurology or cancer care, all of which are incredibly important. But patients get to those services through the advice and the guidance of their GP. And it's a fundamental mistake to have sort of underfunded primary care, which is actually part of early intervention and prevention, which, of course, Wes Streeting bangs on about, but we need to see a rapid change of emphasis.
Well, the current government has been in power for over a year now and has repeatedly committed its commitment to the NHS. You don't feel there has been any change since Keir Starmer came into number 10?
Oh, there have definitely been some changes. The dangerous tendency of the previous government was to replace GPs with physician associates, and to some extent, Wes Streeting put a brake on that. He also has genuinely increased the number of trainee GPs, but the core funding of general practice, which allows GPs to be retained and employed as salaried GPs or indeed partner GPs, that funding has not been there to expand GPs. So literally, GP practices are saying to salaried GPs, we don't have the money to carry on employing you. The numbers of trainee GPs that have finished their training that are unemployed is in the thousands.
So it's not a recruitment problem, it is a funding problem.
It used to be a recruitment problem because there weren't enough trainees in the pipeline, and we're still short of that. But Wes Streeting has made some inroads into that, but there's a serious funding problem, and there's also a serious issue of morale where instead of negotiating with the BMA and doctors with with mutual respect, West Streeting is now sort of at war with the BMA and saying that he can't trust the BMA and he can't trust doctors, which is a real shame and a tragedy, and it must stop.
Dr. Tony O'Sullivan, the co-chair of Keep Our NHS Public and a retired consultant paediatrician, thank you for joining us this morning. I do have to say we've had a statement from the Department of Health and Social Care who said the NHS will always be free at the point of use under this government. After years of neglect, we're finally giving GPs the support they desperately need. A £1.1 billion boost, the biggest funding increase in more than a decade, allowing us to recruit 2,500 more GPs, and that GPs will always be at the heart of the new neighbourhood health services that they're building and will benefit from a growing share of NHS funding.